Basically, I was involved early on with this project, maybe December 2020 when I was first introduced. I'm a physical medicine and rehabilitation specialist, and as we were seeing problems linger on from COVID, patients were not able to get back to their normal selves, and our specialty was taking the lead all across the country with a lot of these different projects. I was approached and was willing to jump in and see what I could do to help, although we knew very little about not only COVID, but what was going to happen after COVID. So it was clear to us that there was going to be a need, and this was addressed, as I mentioned. We started really seeing patients and taking our first cases through the clinic, or what the clinic looked like at that time in early 2021. So we've been at this almost 2 years in terms of actually treating folks, and we're starting to get some good data on what that looks like, and more consistency, more guidelines, and ways to treat these things that are coming at us very fast. Obviously, we didn't know much about it, and we're still seeing that patients are having trouble getting back to their normal lives. Things that we see here in the clinic, oftentimes fatigue. Patients that have been addressed by, that have had the disease firsthand, not only fatigue during the course of their actual disease state, but afterwards for weeks to months, even years now we're seeing this. Brain fog, joint pain, lots of other organ systems that are being affected here, the GI system, the renal system, the kidneys. We're seeing a lot of issues with behavioral health as well. This is a very key component of what we're doing here. We have excellent nurse practitioners and staff here at our clinic that take care of these folks on a day-to-day basis, and I'm serving as the director as well. But additionally, we have recently hired a mental health therapist who will be on site to actually provide care to these folks. But we're seeing a lot of patients with anxiety, with depression, post-traumatic stress, really. You think about just the trauma of what we've all been through as a society and as a region. It's affected all of us, and it's affected our workflows, it's affected our daily lives.